Hi there, I'm Carolyn Zaumeyer here at Low TE Florida, and I'm so excited to have Dr. Derek DeSilva here from New Jersey to tell us more about CBD. We hear about it all the time, but let's get down to it and find out what is it, where does it come from? So what is CBD?
Well, first of all, thank you very much for having me here. It's always a pleasure to come in and spend some time with you and educate everybody, about what's going on out there. CBD is really one of the hottest topics right now in medicine. And I think the first thing we really need to establish is what is the difference between CBD and THC? THC is the thing that produces the high, is the psychotropic agent that comes from the cannabis sativa plant. CBD is non-psychotropic, meaning you don't get the high, you don't get the buzz, and it's completely safe. This is where all of the issues are coming in with legislators, with physicians, and also with people that are watching this, the layperson. They don't know the difference. So again, very importantly, CBD is non-psychotropic. You will not get high. You will not get a buzz, whereas THC is that psychotropic agent.
So it's actually derived from a different plant than, say, marijuana, right?
Well,
going back to the basics, yeah.
Believe it or not, it is the same plant.
Oh.
It's the cannabis sativa plant, but the plant can either be grown for CBD or for THC. So the concentrations, and it goes through a different growth cycle. The harvest is different. In order to sell CBD, it has to be less than 0.3% THC. Okay. All right, so it comes from the same plant, but it's grown differently, and the concentrations of CBD, THC are different.
Excellent. Now, CBD, I've been hearing about it maybe for the last 10 years. How long has it been used in medicine?
The cannabis plant, or the hemp plant, was first used by traditional Chinese medicine. It was one of the first botanicals used in traditional Chinese medicine 6,000 years ago. The plant has been around that we know of for about 12,000 years, but this was the first botanical that was used by the father of traditional Chinese medicine in Chinese medicine 6,000 years ago. So this is not new, and this has been used medicinally, if you will, since the 1930s here in the US. And there's been all kinds of press and if you will, excuse the word, but bastardization of this over the years, and that's where the bad rap came in.
Yeah, it's created a lot of confusion.
Exactly.
So we need to clarify that. Now, in your medical practice, do you use CBD oil?
Absolutely, absolutely. It is estimated that the pharmaceutical industry is going to lose $80 billion in the next 3 years in the pain industry. $80 billion in the next 3 years in the pain industry. So
that's great.
What do I use? What do I use this for? What I use this for are for people that have discomforts. Joint discomforts, body discomforts. That is one of my primary indicators and primary uses in my medical practice. I also use it for people that have trouble, that are nervous and have trouble settling down. It really calms you, and it just relaxes you and settles you down. I also use it for people that have problems with their sleep. And think about this. If you are always hyper excitable, you're not going to be able to sleep. So it has these wonderful roles. If you have pain in your joints, if you're uncomfortable, you can't sleep. So all of these factors come together, and the beauty of this is that it works on all of those systems.
So some people are using it in the morning and some people in the evening, or maybe both?
Absolutely, absolutely. You can use this in the morning, in the evening. And the most common thing that I hear from people is, well, but what, will I fall asleep in the morning if I take this? No. Your body works on what is called a circadian rhythm or a circadian cycle. Whereas, for example, cortisol levels should be elevated in the morning, and throughout the course of the day, they drop. The way full spectrum hemp oil, and by the way, this is another important nomenclature that we have to remember. CBD is a drug. It is Epidiolex and Sativex. Those are drugs that have been approved by the FDA for children with intractable seizures. That's the Epidiolex. And Sativex has been approved as a drug for people with neurologic damage for multiple sclerosis. What we should be saying instead of CBD is full spectrum hemp oil. And we'll get into that in just a little bit.
Okay.
But the way this works, it has what is called adaptogenic activity. It adapts to the way the body's supposed to function. If you're too high, it'll bring you down, meaning your cortisol. If you're too low, it'll bring it up.
Wow.
It adapts to the rhythms of the body. This is the beauty of this.
Well, there's some companies out here selling different things like CBG. What is the difference between this and CBG?
The hemp plant has various cannabinoids. The C stands for the cannabinoid. So there's CBD, CBG, CBA, CBC. These are all cannabinoids. It works on the endocannabinoid system within our body. I have a very, very strong opinion on this. When we start messing around with what God has put on this planet as a plant and taking pieces out, you're going to get into trouble. We're starting to see a lot of people selling CBG and other isolates. Not a good idea, because this is the same thing that happened with vitamin E. We start pulling D-alpha tocopherol out, and then the other components of vitamin E don't work.
Right.
And as a result, what happened? You lose the antioxidative effect. You lose all of the secondary benefits that are supposed to be there. So, and by the way, that is called the entourage effect of all of those pieces working together.
Gotcha. Are there any potential side effects of using this?
The side effect profile is this. If you take too much, you will probably get a little bit tired. All right? You can't overdose on this. And in fact, if somebody shows up in the emergency room and they are extremely high, they have a really, really bad buzz, what we do is we use full spectrum hemp oil to block that effect. So this is kind of the anecdote, if you will.
Wow, okay.
And that is how this is used, because side effect profile, drug interaction, the only thing that I say to people with regard to drug interactions is this. If you are on a blood thinner, you need to make sure that you follow up with your doctor. If you're on Coumadin or if you're on warfarin, it's easy to measure the PTINR or the blood levels. But there are other blood thinners that we can't measure those levels. So again, check with your doctor. What I do in my practice is I cut the dose in half.
Gotcha. So there's not any really known drug interactions other than with the blood thinners we need to be careful, go slow and low to start.
Right. I mean, there are other potential interactions. For example, anything that goes through the liver, which is what is called the cytochrome P450 system within the body, with pretty much any drug that goes through the liver, and that's a lot of them, what you need to do is you need to be a little bit more cautious, meaning cut the dose, half the dose, and again, what you were trying to say was start low and go slow.
Yes.
You know, that's what I tell my patients, start low and go slow.
Yeah. Now, there's many companies out here and different strengths. How do we choose the proper one?
There's a couple of things that you need to look at. First of all, what's the extraction process? How was it extracted? Were the bonds broken was it extracted properly, if you will? Number two is, what about bioavailability? A lot of people say, well, it gets absorbed. Well, how do you know that? What I did was I took our full spectrum hemp oil and I did a bioavailability study on this on humans. I know when it gets absorbed, I know when it reaches peak, and I know how long it stays in serum. And I'm currently also involved in some other studies looking at what is called endothelial dysfunction. What that means is that we look at the inside of blood vessels, and those blood vessels, when they're damaged, will release certain markers. We're looking at those markers to see how and when this will be able to repair it. And I know what it's going to show, that there's going to be improvement. But I want the data. So what I want to tell people is, do you have data? Do you have science? And the other big thing is this. If you take 2 glasses of water, folks, and you put an oil in one of the glasses of water, what happens to the oil?
Comes to the top.
It floats, exactly. With our full spectrum hemp oil, and this is part of the technology, is when you take a couple of drops and you drop it in water, it goes completely into solution. It's the same thing that happens in the body. If your body has to process it, what's going to happen? Bioavailability is going to come down.
Absolutely.
I want to make sure, it's like vitamin D, right? We want to give your body D3. Why are you giving people D2 when your body has to go through a whole process to convert it?
Yeah.
Same thing here. It's absorbable, it's soluble, and it's easier for the body to process.
Great. So this is a great thing for me to add to my practice. So I'm very excited to hear about all this. Is there anything else you'd like to say about it?
I think that, dosage, I think that's another thing that we need to talk, because you asked me about that the other day.
Yeah.
The dose on the Common Sense Supplements Full Spectrum Hemp Oil is 20 drops or 1 ml, and it varies between 20, 25 drops, twice a day. Twice a day. Now, what I tell people is, if you're sensitive, if you're nervous, if you're anxious about taking something like this, start half the dose.
Right.
10 drops in the morning, 10 drops at night. And let me tell you something about how confident I am with this. I have 2 grandchildren, number 3 on the way. They are the love of my life. My children, they annoy me, they're a nuisance, but my grandchildren, I adore them, all right? The best therapy ever. Our oldest grandson is 4. You know what? We give him 2, 3 drops at night to go to sleep. If I felt that this was dangerous or this was in any way would harm my little baby, there's no way I would do it. This is how confident I am in this and how incredible this product really is. I've been doing this for 30 years. I have never in 30 years seen one product do so much. And it's amazing.
Well, it's all very exciting, and thank you for clearing everything up for us, because I had a lot of questions about it myself, and now I'm going to be able to confidently recommend it to my patients that may benefit from it.
Absolutely. Yeah. And by the way, little tidbit for you.
Yes.
I know you do a ton of hormones,
yes.
the bioidentical
yes.
hormones, and
yes.
you're one of the experts,
yes.
you're one of the best. If you combine this with the progesterone at night for sleep, I'm telling you, the women come in and say, I have never slept like that before.
That's so important, because so many women, as we go through our menopausal years, sleep is one of the first things that they talk about. Because with my practice, the number one reason people come in is fatigue. And the fatigue a lot of times is because they haven't had a good night's sleep. If you don't have a good night's sleep, you can't have a good day.
True.
So this can help with that.
Absolutely.
That's fabulous.
You haven't been through menopause. You're not even close to it, so don't even worry about that.
I'm still 17.
I don't know why you're mentioning that.
That's my patience. So thank you very much. Is there anything else we need to know?
The best way to use this, right? A lot of people, and I'm going to be very honest with everybody here. The taste on this is okay, okay? This is not candy. If you want me to make this sweet and you want me to make this taste really good that you think it's candy, I can do that. But then you're adding sugar, you're adding preservatives, you're adding chemicals. What is the best way to use this? You can take this and put it right in your mouth, let it sit there for about 15 to 20 seconds. If for some reason, and then swallow. If for some reason you don't like the taste, what you can do is mix it in a little bit of water, swish it around, take a sip, swish it in your mouth, hold it for 15 seconds, and swallow.
Gotcha.
Even if that bothers you, you can mix it in just a teeny bit of juice, put it in your smoothies, however you want to take
so
this.
That doesn't...
It doesn't change
okay,
it. It doesn't change the
Beautiful.
efficacy. Yes.
All righty. Well, thank you very much.
You're very welcome.
It's so good to see you and to hear how passionate you are about the different things. So thank you for the education today.
My pleasure. Thank you for inviting me, as always.
And thank you all for watching.